mute because I'm driving.
Oh, sorry, I interrupted you, Chris, but noted. Thanks for the heads up. All right, we have a few people already on the call. I think we can give everyone another minute before we get started. Yes, here a wave of people who are clicking on the calendar invite just now. All right, everyone, if there's about 50 of us, we're going to get started. So thank you all for joining us this morning, this afternoon, this evening for our last GFAN call of the year. We won't have any in December. I'm going to say sadly, but I'll be glad. So we'll be back in January, and tonight, this afternoon, this morning, we're going to be debriefing the last Global Fund board meeting. So I'm going to put up the agenda. So we're going to debrief the 40th Global Fund board meeting with two delegations. Sadly, the communities delegation couldn't make it. And so we'll have a developed country NGO delegation, the developing country NGO delegation, tell us their thoughts about the board meeting that just took place and upcoming issues for the next one and the months to come. After which we'll talk about, so we might have seen a series of briefs that GFAN has released over the past 2 weeks on the new TB regimens and how to advocate on how to make sure that they are integrated into funding requests. And so we'll hear from TAG and from TB Alliance on how these briefs came to be, etc. And with this, I will just remind everyone that these calls are being recorded and will be posted on our website as usual. And hand over the floor to Katie for to get us started.
Great. Thanks, Conte. Hi, everybody. Welcome. It does feel a little crazy that it's the last call of the year, but as many of you, I hope, are able to do, taking some year-end time off. And also we have a team retreat in early December. So it's just, yeah, it seems a little early, but also we're getting geared up for 2023. So we'll be back to you early in January. Okay, so we just, obviously, you're not here to hear our reflections around the board meeting, but just as a reminder, GFAN is always invited to attend the board meeting as an observer, which is in addition to my role as a member of the Developed Country NGO delegation. So I do usually participate in those discussions and support that delegation quite actively, and any other delegation that asks, always happy to support them as well. But it was a pretty busy board meeting. It was extended to 3 days. The agenda changed, I don't know, several times. There was a lot going on, and in part that was because the main sort of set of discussions that needed to take place were decisions around the sources and uses of funds. So how the money that was raised for replenishment would be allocated across the sort of funding needs, like the operating budget, OPEX, country allocations, catalytic initiative, et cetera. And so you can see at the bottom of the screen there that thankfully, just in time, I believe, on the first day of the actual board meeting, a number of different pledges came through, in particular the United Kingdom and Italy ones that were, long awaited, as well as India, who came through as well. And I believe there was one more in Thailand, but we just didn't have like a pretty picture to show, or we couldn't fit it in on our slide. So, thanks to all of the advocates in those 4 countries, we know it was a bit of a heavy lift, and getting a strong replenishment pledge in New York was not possible. But it was great that that money came in at the last minute, and the Secretariat really did work rather quickly to update numbers and spreadsheets and presentations and those kinds of things so that people could understand the implications of having slightly, quite a bit more raised, over 15 billion raised after New York. And so that sources and uses of funds was divided up in a couple of different ways, and there was sort of two separate decision points around it. But it was a very critical discussion, and I'm sure our delegations will share with you their sense of how those went. But ultimately, I think there was a lot of acknowledgement around the table from a lot of different country and partner and civil society and community delegations around, this is not as much money as had been hoped to be raised. And it would mean that there would be some challenges to meeting some of the objectives of the strategy, and that the catalytic initiative, for example, will not be as large as it was last time. But overall, a lot of the discussion was very reflective on how to really try and pinpoint what the Global Fund and its partners could do over the next few years, given this less funding than was hoped for, while still being slightly more funding overall for countries than during the previous period. There was also important discussions around extending C19RM through the end of 2025. And while those grants and the country grants that will come through the new allocation will be separate, but it will allow them to complement them. And there was some discussion about how important it was that was made possible. There were really interesting thematic discussions on communities and gender, and as well as pandemic prevention, an interesting conversation around the Global Fund's approach, or where it was sort of feeling around the opportunities or not that were presented by the Pandemic Fund. And then there was all of the other things that take up a board meeting, as we all know, in terms of governance in organizations, KPIs, key performance indicators, monitoring, learning and evaluation plans, for the new strategy, risk management. There will be new board leadership coming next year. And of course, the Office of the Inspector General's report, which is always quite interesting. We have published earlier today, before I was awake, I think, before many of us were, a report from us, which is long. But if there's any parts of these that you're more interested in, you can find them in that report. And hopefully it helps just remind you of where the discussions were. So that's just my quick sort of overview and my sense of it as an observer and participating in the delegation. But I wanted to pass it over to colleagues from Developing Country NGO Delegation and from the Developed Country NGO Delegation. And I would just note for them, if they have slides of their own, we're happy to pull them up. But we also just prepared, we just also can flip really quickly to that sources and uses of fund diagram if you need it, Carolyn or Robin, as well as that sort of chart of the positives and challenges around replenishment. So just noting that we put some of those into a slide just in case that would be helpful as you're discussing. But Carolyn, I think I'm going to hand it over to you. So Carolyn, good morning.
Thank you, Katie. Good morning, everyone. Good evening, good afternoon across the world of GFAN friends and family. I think Katie has more or less given you an overview of the meeting. I don't know that you need more from me, except to talk about what we thought were really important highlights. And I think being Developing Country NGO, I think one of the things we want to reflect on specifically is that we finally got at this in-depth discussion around communities and gender at the board table. For many, many years now, we have seen community, the CRG report, relegated to the pre-meeting day at the Global Fund Board. And this despite the fact that our strategy that we adopted more than a year ago spoke of the centrality of communities at the center. But we were finally able to get first through the strategy committee and then at the board table, a very excellent discussion on communities. And this included a section on community as it relates to community health workers and community intersection generally with health systems. And we had a really great presentation, both by the community side of it, but also and the department. This was led by Keith. Keith spoke about what Keith Mimi's talking about how we were going to measure increased involvement, And Katie, I don't know if you have that slide, that presentation available to you. That, if not, no worries. The slide on communities, where they speak about what changes need to be made and how they intend to make these changes in order to be able to strengthen community involvement across the life cycle of the grants. And then we had some discussion around how we are going to be measuring this, and also how the strengthening of the community involvement in healthcare is going to work. So it was a really excellent discussion. As I say, really glad that we got it to the board table. And one of the most pleasing parts about it was at the end of that discussion and presentation by the CRG department, in conjunction with the RSSH department, as it relates to community system strengthening and community health workers' involvement in healthcare. At the end of that, we had a round from the board table that was overwhelmingly positive, that spoke about this being the need that needs to be reflected in the grants, that this work has to be strengthened, that the department needs to be strengthened to, in fact, there were even a few suggestions that CRG be elevated to the MEC, to the level of the Management Executive Committee. But there was overwhelming support from the constituencies on the board for the need to take this work forward urgently, and that there needed to be adequate allocation. And coming out of the great decisions around, well, the decisions around sources and use of funds and the OPEX that were taken, we were happy with that late-breaking interventions from the UK and commitments from the UK and Italy and India, that we were able to increase the OPEX, and that increase in the OPEX was to be focused primarily around community rights and gender strengthening at the Secretariat. The gender presentation was excellent as well, got a great deal of support from the constituencies. How we're going to integrate gender and what we're going to do in terms of monitoring, managing, and keeping an eye on how gender is, how the measurement, management of gender across our programs will be taken forward as a KPI, really. And so that I really want to highlight that as one of the big takeaways for the developing country delegation, one of the celebrations that we need to celebrate, because quite frankly, if it wasn't for GFAN pushing, in conjunction with some donors who really think that community rights and gender are important, we would not be at this place where we have it, at least a plan for the centrality of communities and for rights and gender in our new strategy, and some funding behind it, which is always very key. The other thing that was really and I'll leave the sources and uses of funds, because I think we've all focused on what money will we get, how will we do it, and we have a plan. We have a slightly better plan. Some disappointment, we didn't make the 18 billion we wanted, but we did, by the time we got to making a decision, have $15.7 billion, which is a massive replenishment. Work is ongoing in the Secretariat to work to make sure that the set-asides actually integrate and complement the work of the Global Fund on both the country grants as well as the catalytic investments. So I don't want to talk too much about that, but I do want to talk about the other decision we took, which was quite groundbreaking, which was the approval of the monitoring and evaluation framework and the multi-year evaluation calendar. You all will remember that the Global Fund last year took a decision around the shape of the evaluation function that the Global Fund will have going forward. And it's a new type of it's not replicated anywhere else, this evaluation function that the Global Fund has. So there's the independent evaluation panel, which replaces the TURG, which is in charge of doing the evaluations and is completely independent from the secretariat. And then there's the Chief Evaluation and Learning Officer who was employed and joined the fund in October this year to coordinate and make sure that what the work that the Global Fund does is properly evaluated, but not and monitored, but not only that, helps to inform how the Global Fund changes, the Global Fund learns from its work. So we've seen a number of reviews, OIG, TURG, about the Global Fund innovation, and it speaks a lot to the fact that the Global Fund has not been as good as it should have been at picking up innovations at country level and helping to translate them across the globe. And so this is one of the things that the new Chief Evaluation and Learning Officer, John Grove, will have to focus on to make sure that when a country or a civil society PR develops a new way, a new and exciting and effective way to deliver on the Global Fund's work, that this learning, this new way of delivering is actually picked up and shared across the partnership, across the globe, as a promising practice, as a good way to move forward that may be applicable to other countries. And that's going to be one of the things that we'll be keeping an eye on to make sure that we are doing this, because we know that civil society can and has new and innovative ways to reach and deliver programs, prevention, etc., and that we need to be making sure that these reach to actually change the Global Fund's practices in a way that allows us to replicate them and go forward. And with that, Katie, I think I'm going to stop because those were the highlights for me of the meeting, aside from the fact that we had a united board. And just as a little joke to end with, as we were struggling to discuss and to find the sources of funds and to think through and to dialogue how we were going to do this, someone said to me, the secret to all of this, why we're finding agreement, is because we got the really bad news at the beginning, and then we got a little bit of good news in the middle. And so that little bit of good news makes the decision we want to take much easier to take than the bad news. And so everybody is ready to take a decision. And it was fun. The unity of the board, I think, was really good. And the purpose exhibited at the meeting was really good.
Thanks, Carol. And I think there was a lot of people with that sense. It certainly was challenging discussions. And that point that you made around the lessons learned and making sure that new sort of strategy around that, I think there's always the cautious person in me who hears things like, we'll just have to do more with the money that we have. That feels like the way that we've been operating for so long. And it would, it would be nice if we could meet our targets and have the most ambitious targets that we need. But ultimately, obviously, sharing those lessons learned and figuring out and finding out when innovative new approaches or new solutions have come together, that will be interesting to see if the Secretariat is able to, and that unit is able to share that out in a way that's more effective for everyone to learn from each other. So anyways, thank you for those reflections. We do normally, good morning, Max. We do normally just hear from all of the delegations and then open it up for questions and answers. So I think we'll do that today. But of course, if there's any points that you have that you want to raise, feel free to in the chat if it would help your understanding of the conversation a bit better. We'll do our best to answer or come back to it. So please do use the chat if there is anything that's sort of like, what? But we'll hear from Robin, who is the outgoing board member for the Developed Country NGO delegation next. So Robin, if I could pass it to you.
Thanks so much, Katie. Can you hear me okay?
Yep, you're clear.
Okay, perfect. Hi, everybody. Good morning, good evening, good afternoon. So as Katie said, I'm the outgoing board member and outgoing chair of the implementer group, outgoing board member for the developed country NGO delegation, and Beatrice Stickers from KNCV in the Netherlands will be the person who will be stepping into these board member shoes and already has as of the end of this board meeting. So just in follow up to Carolyn, you know, I think, Carolyn, you've really shone really important reflections on the advantages and the constructive discussions that really did happen around the board table. So that's really, really helpful. Maybe I can spend just a couple of minutes here on the sources and uses of funds. And go through a little bit around C19RM and some of the key things, key messages that our delegation was really trying to drive home across each of the sessions at the board meeting. So in terms of sources and uses of funds, I'm not necessarily going to go through each of these different bar graphs. I'm just going to point at the important pieces. So as Carolyn said, we got to the board table. It was a lot of people nail biting. And we learned that we had more money than anticipated. And so it really did help to relax the conversations considerably while still everyone recognizing that we haven't hit the 18 billion mark, but we have come close to the 16 billion mark. And so that added extra from the UK, from Thailand, from Italy, and who was the other one? From India, really did make a huge difference. And so what we are looking at as when we are looking at the sources of uses of funds, of how this is all going, the pie is going to be split. This almost $16 billion replenishment means that there will be, instead of a minus 2% increase for, 0.2% increase to country allocations. With this additional money, the country allocations have been bumped up to a plus 3.3% increase, which is going to be really important given all of the economic constraints that we have with inflation and closing fiscal space for a number of our countries around the world. It also meant that, as Carolyn was mentioning, that there's a slight increase in the OPEX, or the operating expenses of the Secretariat, which will allow for greater capacity on certain areas, including communities' rights and gender in particular, but also on market shaping, which was a key discussion point as well. When it comes to catalytic investments, the additional pledges resulted in an additional 100 million being added to catalytic investments. So as you might recall in our pre-board meeting brief, we went through the catalytic investments and saw that originally they were ascribed to, I think it was $200 million. Which is significantly lower than they currently are at $800 million. And that the Global Fund Secretariat had proposed to add an additional 100 million in order to unlock some of the private sector investments that were for catalytic projects, and that it would help to increase also opportunities for community engagement in these different areas, such as digital health, for example, and community health workers. So we were going in with that decision at 300 million. The additional money coming in from the replenishment added an additional 100. So we're looking at 400 million for catalytic investments. There was a lot of mobilization and full mobilization across the implementer countries around the importance of including multi-country grants in the catalytic investments, which we saw that there weren't any funds in the original 300 million scenario. And so the implementer country group actually developed an implementer group statement stressing the importance of multi-country grants. And so we were thrilled to see that that actually had come into the next scenario under 400 million, where we do have now multi-country grants for HIV. We do have additional funds in for strategic initiatives. We do have some additional funds in for community engagement. And TB, although it didn't see an increase in its catalytic investments, given the increase to the replenishment amounts, that calculation that was agreed upon a year ago at the November 2021 board meeting around the global disease split did allow now for a slight increase in TB funding. However, that was one of the key pieces of our interventions at the board table, is that we really need to a call for the board to have an in-depth discussion about what we are going to do to increase funding for TB, given that that was understood as one of the key priorities going forward after the discussion and decisions around global disease split. So wholly what's the word? Not enough funds, in other words, for TB, and we need to do something about it. Another piece is around the C19RM and how that is going to come in and complement the RSSH work under the new allocations, and to ensure better coordination and less duplication across those different funding streams. It's clear that the C19RM is still going to be a separate track and is not going to be integrated into the full country allocations. So we will want to keep an eye on that as civil society and community to ensure that the proposals going in are really fit for purpose, and also include a much bigger allocation for community rights and gender within the Global Fund's COVID-19 response mechanism, because as we've seen from the different reports, it has been largely commoditized, and health systems as opposed to community systems that have been the focus of attention under the C19RM. And hopefully with the longer now window for preparation, that there will be opportunities for greater funds for community rights and gender. But I guess that is, coming to one of the key messages that threaded throughout our delegation's interventions, was really trying to emphasize the fact that we need to follow the money. And so really pushing the Secretariat to ensure that the funding data coming out of the country allocations and the catalytic investments are reported on in such a way that community and civil society and the board are able to follow the money, knowing that communities are at the heart of this next strategy. And, 2 of the 4 strategic objectives specifically focus on community rights and gender and human rights and health equity. We need to be able to track exactly how much money is actually getting to communities. And in the past, the Secretariat hasn't really collected data in that way. But it was certainly clear from our interventions that that was one of the step changes in terms of data that we were demanding to be seen. Also in the way that things are to be recorded and presented and reported on under the new KPI framework and monitoring and evaluation work plan. For instance, we did make the point at the table that when we're talking about community systems and responses, often what happens is the focus and the funds go to community health workers and don't actually trickle to actual community organizations who are at the front lines. And so that was one thing that we really wanted to tease out, and it's not saying that the work of community health workers and the funding of community health workers is any less of a priority. It's just really trying to disaggregate those issues so that we have a clear sense of how much money is going into communities and civil society, and how much of an increase it is over previous allocation periods. So I think that is where I will stop, but looking forward to hearing all of your thoughts and comments and questions. Thanks so much.
Thanks, Robin. There's been a bit of chat, a few questions there, one around matching funds and one around the catalytic investment community systems and response is one. So just while you ponder those, just to be clear with everyone, the board documents are always considered confidential and private. And so sharing the few that we've chosen here are because we feel we can because they're not top secret in a way. Like this is all pieces of information that will be filtering out anyways, but we have shared the link to where those documents will be published. And for example, on the catalytic initiatives, there is a table in the document around sources and uses of funds, and Carolyn and Robin can, feel free to share it if they'd like to here, but essentially there was an established, at the previous board meeting, there was an established set of investments that would occur based on the funding level that was available for the catalytic initiative. And to some extent, the discussions that took place at the board meeting were what little flexibility there was in that guidance to make the best use of the 400 million when obviously it was hoped for that the catalytic initiative would be more than double that. So apologies if it feels a little bit disjointed and difficult to follow. It's mostly just because we can't actually share some of that information because it's still considered confidential, I think. Maybe I'm being too cautious. People can tell me if I'm just being too cautious. But there's a couple of questions there in the chat that I'll hand it back to Carolyn and Robin to address, as well as invite you to raise your hands. One question that I do have, and I think I've asked this during the board meeting, but it would be great to hear your reflections here, is there's no sort of established mechanism for additional funds as they come in after the replenishment, and this initial allocation formula has been run on the money that's raised in the replenishment. I think we have a strong sense that ongoing resource mobilization to at least a larger extent than has happened in previous ones for core work, the 5 billion raised during the last interim period for COVID and C19RM notwithstanding. So the question would be, do we have a sense where there are discussions around how additional funds would be used and how decisions would be made around additional funds that do come in from other donor countries or private sector or other sort of sources of fund from new foundations, or private philanthropy donations or anything like that? So that's my question. I think it would be useful to hear your reflections on, but I would invite you to also address the questions that are in the chat. So Carolyn or Robin, I don't know which one of you wants to lead off. And I know there are probably other members of your delegations here on the call that you may want to call on as well.
Katie, let me jump in around the question and this is from Tom, about new NFM4. So NFM4 is fixed going into the next 3 years. That's what we're using to calculate disbursements and allocation and use of funds. But there is an opportunity next year coming to at least the strategy committee, if not the board. There's going to be an evaluation of the entire, it's part of the multi-year evaluation calendar, an evaluation of the global funds funding model. And then that evaluation will hopefully be followed by some discussion, at least at the strategy committee, but if hopefully at the board, because this was a commitment from the GDS decision, the global disease split decision that we took with such difficulty last year, that we would look at the entire allocation model. And it will be revisited with an evaluation, and then from there, further decisions taken. The catalytic funding, as Asia is talking about, I don't have the table in front of me, but we've finally approved. But we are looking at something around $50 million for the effective community systems and responses. But that is only in relation, that is only one of the community stuff, because we also have community engagement, catalytic investment, and we have the human rights programs as well. So this is where we're at. This was the table that we base approach. So I think that's where we're going to land. But it's not, we haven't seen that. I don't have the final table in front of me. And that money was bumped up with some private sector updated totals. How are we going to deal with updated from here on, where if we get more commitment, it's not clear. And I know the work is ongoing to look at the set-asides and see if they can fit in the catalytics, which sort of line items, how would that work? Or if they are to work with allocations, how would that work? So we don't have a real way forward with that, but those are decisions that would need to be taken between the Audit and Finance Committee and the Strategy Committee.
Thanks, Carol. Yeah, go ahead, Robin. Sorry.
Thanks. So I'm just looking at the different questions that are coming in. So Asia, in terms of your question around CRG, so given the lower funding amount and funding scenario that we're looking at, I think it's safe to say that CRG related issues fared fairly well in terms of increased funding within that 400 million for catalytic investment. And also within the OPEX, the funding increase for OPEX will be going to CRG as well. But there is also a major reorganization that is happening within the Secretariat as well. So we'll help to keep, maybe that's a topic, an ongoing topic for future GFAN calls in the new year. The one thing that became really clear, and I think it's becoming clearer within the different information notes and the modular framework that is up on the Global Fund website, is that CRG related issues are considered what they call program essentials for country allocations. And so there are a series of program essentials under HIV, under TB, and under malaria, under RSSH, and community rights and gender fit into all across those four different areas. So if folks haven't seen it already, there are a number of new updated important guidance on the Global Fund's website for this NFM4. One is on, well, there's HIV prevention, which I think has been up since August or July. There's one on harm reduction, the one on human rights, and an updated version or an updated information note on community system strengthening. And so what the focus is, although catalytic investments, of course, are incredibly important to all of the work that we do as a community and civil society, we're really trying to ensure that all of these issues get front and center within country allocations. And so part of that has been also advocating for country allocation letters to be made public so that everyone has access to a better understanding of what the financial framework is, as well as what some of the guidance is that the Secretariat has provided to each individual country for its next allocation. So yeah, so really looking at how community rights and gender, community systems and responses can be integrated into the different modules like RSSH, like private sector engagement, and really trying to keep an eye on, I think, portfolio optimization as we go forward is going to be really, really important for us to keep an eye on, because that's where a number of donors, but also some secretariat members have indicated that that could be where some additional funds could be found for catalytic investments, for example, for market shaping. So I think I'll stop there.
Yeah, just to add one little bit to Asia's question around the actual, what used to be the community engagement line item, which was what was essentially the amount of funding that CRG controlled. But there will be additional funding across the new line item, which is effective community systems and responses. That will be a strategic initiative heavily worked in conjunction with CRG. And I also know that work has begun for some of that specific community engagement bit, which is like the platforms, the Francophone, the Black platform, the African, the Asian, that will be as well as technical assistance, which is operated directly through CRG. Some of that requests for technical assistance, they already have an understanding and a working methodology with CRG does, where in places where the French or some of the other technical partners are working, that they will be able to pass those requests for technical assistance as applicable through to those partners, so that the technical assistance won't necessarily come out of their line item, but will be provided to communities.
Thanks, Carolyn. I think that's a helpful addition, because there was, I don't know, Conte, if you can pull up that sources and uses of fund chart again, but there was a lot of discussion about sort of the increased amount of set-asides, as they're called. Oh, now we're going through a we're going through a board document. Nobody look. There it is. But those adjustments in that second sort of column that you see there, that 1.9, that does include other things like hedging and foreign exchange sort of calculations, risk management, that kind of thing, as well as, I believe, most of the possible additional US dollars that might be available that aren't currently available because the additional funds have not been raised. But there was a lot of discussion around the increased amount of actual sort of set-asides by governments in their pledges. So where they set aside certain amounts for technical assistance, and those funds don't go directly to the Global Fund. And there's not, I mean, there's varying levels of transparency and understanding of how that funding is used. And there was a lot of discussion at the board meeting, and a lot of, I would say, pointed remarks, I think, that were addressed to those donors who have made those set-asides about being more transparent and making sure that that funding is being used in a way that really benefits the overall kind of programming, particularly around the catalytic initiatives and where there's some gaps. And so I think there's a conversation, or at least an openness to that discussion in a way that I think was tried after the 6th replenishment to understand those a little bit better. But I believe that there's a little bit of pushback about how that is sort of managed and maintained by countries, announced as part of the pledge, but the need for countries and donors who choose to do that to align better maybe with the needs, and to focus on making sure that that those monies are used in the best possible way to support the work. So and just noting in the chat a question around the calls. And so for everybody, a reminder that we do post the recording and the materials that are shared during the calls on our website, and the link is there, or not the link, but you can find it on our website. And also there was a question earlier from Tom, and I'm just wondering if he wanted to unmute or and ask that question, but also noting Robin's hand is raised. So Robin, perhaps I'll go first to you, and then Tom, if you did have a question or clarification around your question, pop it in the chat, or we'll call on you after. Robin, go ahead.
Thanks, Katie. One piece that I forgot to mention just in the general report back, but seems to be important right now is so that the board meeting kicked off, not with the executive director's report, but with the report from external relations in the communications department around resource mobilization. And so it's great that we've gotten to 16 billion, but we still need to get to 18 billion and plus and beyond. So that was one of the questions that we raised at the table in a request for a costed work plan from that secretariat team to understand how is it that we are going to continue to mobilize these resources moving forward, so that we can hit the 18 billion mark or hopefully above. So we didn't get an exact date for when that was going to be provided, but we are certainly hopeful that it will be at the next Audit and Finance Committee meeting, which will be in March. And Audit and Finance Committee, of course, is the committee that oversees the external relations and communications department with regards to resource mobilization. So that was a concrete demand that came from our delegation. And in response, they said that they were working on it, but they were also taking a bit of a breather. So again, hope that we will have more clarity from them as we go into 2023, the first quarter. Thanks.
Thanks, Robin. I'm not seeing any other hands raised at the moment or any new questions there. And I think I would just like to close in terms of noting that during the board meeting, through many different presentations from Global Fund Secretariat colleagues, as well as colleagues representing other constituencies at the board, donors, implementing countries, there was an awful lot of appreciation for the work of civil society and communities in the resource mobilization effort. And so just to say to you all that, that work was noted, as has been said on past GFAN calls with colleagues from the external relations team, is considered one of the success factors and something that needs to be make sure that that is paid attention to and supported appropriately ahead of the next replenishment. So just underscoring again, didn't get the money that we wanted, didn't get everything that we wanted in all of the decisions. Some important gains were made thanks to the new funding that came in during that week of the board meeting, and really, really constructive conversations amongst constituencies. But there was a lot of appreciation for the work that we do, which is so important to support those broader resource mobilization efforts. So just to wrap us up on this board meeting, just on a positive note to all of you. So thank you for all of your work and dedication. And sadly and unfortunately, we will be calling on you more than we normally do in the interim part of between now and the 8th replenishment, which already feels around the corner. But we all do deserve a little bit of a break. So thank you, everyone. So we do have a slightly longer call than normal. I hope people noted that and are able to stay for the next section. So I'm going to pass it over to my colleague Conte, who's going to lead us through an introduction. And we have colleagues who are joining us to discuss this. So Conte, I won't take any of your thunder and just pass it over to you to introduce this work.
Thanks a lot, Katie. And so actually, I'm very glad that Caroline got a really good segue into this when talking about the board. So as you must have seen in on our social media and through Listserv, we've been releasing a series of GFAN briefs on new TB regimens that are shorter, that are safer, that come with fewer side effects and a huge reduction in pill burdens, which is very exciting. And as Caroline highlighted, a challenge for Global Fund program has been to pick up innovation, make sure that they are made accessible and they are made accessible quickly to the right people. And so with the help of Lindsay McKenna and Robin Wade, who's on the call, we've worked on a series of briefs to guide advocates to make sure that those new regimens enter the conversation around the conversation early around the funding requests to make sure that they are people know how to raise those discussions during consultations, during CCMs, and then keep this conversation going and handle any any tough question that's coming your way or any overcome any resistance. So I won't take too much time because I feel like the colleagues on the call have a lot more expertise to speak of those, one on the regimens, but also of the broader campaign. And so I will call on Lindsay, I think, first to tell us about the tag campaign. I'll stop sharing so that she can pull her screen up. There you go.
Yes, thank you so much. Let me just pull up a couple of slides and make sure that you can see them. Sorry, my computer's a little slow. Are you able to see the slides?
Yeah.
Perfect. Yeah, so thank you so much for that introduction, and to GFAN for all their work to put together some briefs to support advocacy around this campaign and the shorter regimens that it represents. So I'm Lindsay McKenna. I co-direct the TB project at Treatment Action Group. And 146 by 24 is a campaign to rally energy, political will, and funding to end TB. So first, what does it mean? The 1, the 4, and the 6 each represent the duration of the shortest available regimens that we have for both the prevention and treatment of TB. And the by 24 offers us a deadline by the end of 2024. And this is when we want to have in place the staff, the space, the systems, and the support needed for these shorter TB regimens to be made accessible to everyone, everywhere as a human right. And in addition to the campaign kind of calling for access, universal access to the short course regimens for TB prevention and treatment, we are also calling for the acceleration of priority research to make sure that the benefits of these short course treatment and prevention regimens can be extended to everyone, including groups who cannot currently benefit from access to shorter regimens due to data gaps or research exclusions, groups like young children for some of these regimens and pregnant persons. So why do we need this campaign? I don't think I need to do any explaining to this group about how affected we've all been and our movements have been by these concurrent, ongoing health, economic, social, and political crises, and the impact that they've had on our progress, in particular in the fight against TB. I think if you've been paying attention to the WHO global TB reports that have come out for 2 years in a row, we've seen TB deaths increase, devastatingly reversing a trend that previously was going in the other direction. And last year, for the first time, the data from 2021 show that we also are now seeing an increase in the number of people who are falling ill with TB each year. Also, if you take a look at the targets that we together set out at the last UN high-level meeting in 2018, we've missed nearly all of them. And so we really need to infuse some energy back into our movement and feel like this campaign offers something, a unifying thing that is inspiring, that we can rally around. And it's really the result of 20 plus years of research and investment in research to meet the demand to shorten, simplify, and make safer TB treatment. We finally have these regimens that have been so long called for, and yet very few people around the world have access to them. And we can change that. And that's the point of this campaign, really. And if you look at where we've come from, it really is impressive in terms of what we've been able to do with TB prevention and treatment regimens. So for TB prevention or TB preventive treatment, we've gone from a place where we used to only have 6 months of daily isoniazid to a place where we now can prevent TB in as little as 1 month. And you can see the effect on the pill burden as well, going from a place of asking people to take 180 or more pills to just 36. For drug-sensitive TB, we have been able to chop 2 months off of treatment. And you can see the effect on the pill burden there as well. And I think where the impact maybe is most dramatic is for the treatment of drug-resistant TB. We've gone from a place of having regimens made up of 7 to 9 drugs that need to be taken for 9 to 24 months to a place where we have 6-month regimens made up of just 3 or 4 drugs and that are all oral and don't have painful kind of daily injections that have permanently disabling side effects. So we really should be excited by the scientific advancements that have brought forward these short course regimens that really improve TB treatment across the board. So just taking quickly a closer look at some of these regimens for folks who may be less familiar. The one, which stands for 1 month or once weekly regimens for TB prevention. And so that's represented by 1 HP, 1 month of daily isoniazid and rifapentine, 3 HP, which is taken once weekly. That's where the other one comes from. So 3 months of once weekly isoniazid and rifapentine. And then for especially young children, we've also included another regimen called 3HR, which is 3 months of daily isoniazid and rifampicin taken daily, because there are still some data gaps for rifapentine in really young kids, but we want to make sure that they're not excluded from the benefits of shorter course TB preventive treatment regimens. When we talk about the 4 in the 146 campaign, we're talking about 4-month regimens for drug-sensitive TB treatment, and that consists of 2 different regimens. The first is for adults and adolescents down to 12 years old, and so that regimen is 4 months of isoniazid, rifapentine, moxifloxacin, and pyrazinamide. This is the regimen that came out of a study conducted by the U.S. Centers for Disease Control and Prevention's Tuberculosis Trials Consortium and the NIH-funded AIDS clinical trials group. And basically what they did was they swapped in rifapentine for rifampicin, and they swapped in moxifloxacin for ethambutol. And what they found was that by doing that, they could cut 2 months off of treatment and still have very great cure rates and safety. For children 0 to 16 years old with non-severe TB, the 4 represents the SHINE regimen, which is actually the same as the 6-month regimen, but because it's given to children with non-severe TB, the study found that you could cut 2 months off of the continuation phase of treatment. So we have these 2 regimens kind of covering all ages and allowing shortening of treatment for drug-sensitive TB from 6 down to 4 months. For the 6 in the 146 campaign, we're really talking about treatment regimens for drug-resistant TB and what we refer to as the Bpalm regimens. So this is a 6-month regimen that is made up of bedaquiline, pretomanid, and linezolid, with or without moxifloxacin, depending on the drug sensitivity profile. And just to take a step back to talk a little bit about the origins of this campaign, it really is inspired by the late Dr. Paul Farmer. One of the things that he did for the TB movement was bring this frame of the right to science into TB. And he talked about how governments really have a duty to make available and accessible to all persons without discrimination, especially to the most vulnerable, all of the best available applications of scientific progress necessary to enjoy the highest attainable standard of health. And so what we're saying is that these short course regimens are the best available applications of scientific progress. And so people have a human right to access these regimens, and governments ultimately are the duty bearers responsible for making them accessible. Another thing that Paul Farmer, among many things he did, he offered a framework also for introducing or creating and improving access to scientific innovations, what he called the 5 S's: the staff, the stuff, the space, the systems, and the support you have to have in place in order to make things equitably accessible to everybody. So the staff is self-explanatory. Do you have paid healthcare workers? Do those healthcare workers have the stuff, what they need, the quote unquote commodities, the medicines and diagnostics in place? Do they have space to offer dignified space to offer consultations and care to people in need of treatment and preventive therapies? And are there systems in place to help support these things? And then lastly, the most important piece is support. So making sure that people have what they need to successfully complete treatment. And this one requires probably the most multi-sector and fully financed approach. And so while the name of the campaign 146 by 24 might focus on the regimens themselves, the campaign is about much more than that. It's about claiming the right of people with TB to enjoy in the benefits of scientific progress, which is, as we said, a precondition for the right to health. It's about getting in place the 5 S's needed to successfully make available today's short course regimens for everyone, everywhere. And in doing so, we hope to bring to the global fight against TB by the end of 2024, the energy, resources, and common cause really necessary for us to get back on track to ending TB. And for those of you who were around in the early 2000s or who come from work on HIV, the 146 is inspired in many ways by the 3x5 initiative, which in the early 2000s was an initiative through which the WHO and UNAIDS sought to put 3 million people on HIV treatment by the end of 2005. And while they didn't ultimately achieve that target, I think they only got halfway there. It really changed everything and created the conditions for global scale up of access to treatment for HIV. And so we really feel like 146 by 24 is TB's 3x5 moment. And we hope it can similarly create the conditions we need to really change the direction of the fight against TB and get us back on track and in a place of more ambition, especially ahead of the next high-level meeting, which is in September of 2023. So the campaign primarily speaks to national governments and calls on them to, as we said, put in place the 5 S's necessary to ensure equitable access to the short course TB prevention and treatment regimens. It calls on them to update guidelines, to update national strategic plans, and to make sure that they have kind of the funding and infrastructure in place to support access to these short course regimens. The campaign calls on donor and funding mechanisms similarly to help support countries to do those things, and also to support civil society and community organizations to work on national campaigns and accountability initiatives and help to contribute to this. And then also to expand resources and capacity necessary to accelerate research to fill some of the gaps that we mentioned earlier. It calls on pharmaceutical companies and diagnostics companies to help with some of the stuff under the 5 S's. So developing fit for purpose formulations, pricing them affordably, making sure that they're equitably accessible, developing fit for purpose diagnostic technologies, again, pricing them affordably and making sure they're equitably accessible, making sure that those key products are registered and available in countries, and also committing to addressing outstanding research priorities, which we highlight on this slide. The campaign also is making asks to research networks and institutions to accelerate research to close some of the gaps that affect the implementation and scale up of these shorter regimens and supportive technologies, especially in key populations who are historically kind of underrepresented in the clinical trials and research in TB. So what are some key opportunities? Probably 4 and 5 are most relevant to this group, but if you are, a national advocate, national activist working within your countries, if you're part of country dialogues around updating national strategic plans or the country coordinating mechanism, what can you do? Take stock of where your national government is at with respect to introducing and implementing the short course regimens. Find out what the barriers are, what is being done to address them or not yet being done to address them. Elevate the campaign to higher levels of political attention. Participate in national dialogues and really think about how we can leverage opportunities or the opportunity we have in front of us with NFM4 to make sure that global fund funding is creating access to the best available applications of science and standard of care for people with TB, which are these short course regimens. And so I have put a QR code here, but I'll also, after I stop sharing my screen, pop a link in the chat We have a landing page for the campaign on the TAG website where you can find lots of different resources, including a set of slide decks that can be used to help train community and civil society groups on the 146 by 24 campaign. We have template letters that you can use to engage with your country governments. And then we also have commitments from some key kind of global health actors, including the Global Fund, that can be leveraged to really push for ambitious national strategic plans for TB, and also proposals as part of TB proposals as part of NFM4. So there are lots of resources, there are lots of ways to get involved in the campaign. And I think I have one more slide, which is just to acknowledge the coalition of organizations that have been supporting the development of many of these materials and helping guide the direction of the campaign. And that's it for me. So I will maybe stop sharing and see if folks have any questions.
Thank you so much, Lindsay. Do we have any questions in the room? Please raise your hand. Or, yeah, go ahead, Peter.
Yeah, thank you, Lindsay, and thank you for initiating the campaign right from the Canada Declaration. Was it Canada Declaration? Yeah, but I realized I've been reading some articles, and I saw quite a number of people had written pledges and commitments to the campaign. And that includes my organization, the head organization, that is Stop TB Partnership. But I also was feeling that the communities themselves, the beneficiaries themselves should also would have had an opportunity to make a statement, because there is need for them to create demands themselves, and for people who are going to benefit for them. They have been waiting for science, and science has done its part. So I thought that we wanted affected communities to also make a strong statement and create demands both in country and also when we are grant making at the Global Fund. Yeah, thank you.
Yeah, thanks so much, Peter. I think that is the point of this campaign, is it is supposed to be civil society and community led. And so, yeah, I think it will be critically important for community and civil society groups to really bring a strong voice into those conversations. And, you know, TAG at least and GFAN and other partners involved in the campaign are happy to support community and civil society advocates and provide you with kind of whatever resources, technical assistance, anything we can really to help support that. But I think, you know, the push, the advocacy, the fight really is going to happen now at the national level. And so, yeah, let us know how we can support you.
Do we have any questions? I see a remark from Naomi connecting adherence and treatment length, and I think it's really, yeah, I think it's really the key there to try to ensure to facilitate adherence by not just length but also reducing side effects.
Yeah, absolutely.
And Lindsay, Lindsay, I just wanted to add that this came at a very right time. In Kenya, we are just making the national strategic plan, and we have our key people making sure that this one is included in our strategic plan, and also to push for the government that any regulations that might delay the regulatory authority that might delay this one, we should be ready to see from the push fact that you've already shared with us. Thank you.
That's great. That's really great. I also will just put in the chat a link to, so as Peter mentioned, like the soft launch of this campaign was in Montreal in Canada at the International AIDS Conference. We did a second launch virtually during the USAID TB Symposium, where some of the key kind of global health actors, including, as Peter said, the Stop TB Partnership made some commitments about what they are going to do. One of the groups that made a commitment was the Global Fund. So I'm going to put a transcript of the Global Fund's kind of pledge in the chat, which you can refer to in your advocacy. And then also in the GFAN briefs, this is also linked to, but the Global Fund kind of TB information note also talks about these short course regimens. Some of them are considered program essentials, which I think was mentioned earlier on the call. And basically it says the Global Fund, is willing to support implementation of these regimens. So there are lots of documents, I think, that we can refer to in our advocacy that kind of back up the idea that like, these are WHO recommended already, like they are evidenced by great science. The Global Fund has already listed them as program essentials. And so now how do we make sure that we're getting them into national strategic plans and funding proposals?
Lindsay, I see a question in the chat from Tom.
Yes, is there a chance we should have prepared social messages and graphic materials we can use to take these to the grassroots? Yes. So we actually developed some slide decks, what we're calling community campaign training materials. These were really developed with the community in mind and really kind of more slowly walk through each of the short course regimens and do some treatment literacy around them, and then walk through the different actions that advocates can take. So I'll put a link to that in the chat, but we also are working on, and I know TB Alliance already has some videos available that are linked to in the 6th brief. We are working on some videos for social media that really put the affected community and TB patients at the center of the campaign, where they will be videos interviewing people who have had lived experience with TB, who have had experience with some of the longer treatment regimens, and really talking about from their perspective, this campaign and what needs to happen and why it's so important for people to have access to the shorter regimens. So basically it's to say, like, we are sailing the ship or building the ship as we're sailing it, and lots of things are being developed. So if there are like materials that people feel would be really helpful to have in their work, send us an email and we can try to help develop those.
Lindsay, I think if I don't see any more questions in the chat, I think, should we move on to Robin's presentation?
Yes, I just want to say thank you again for making space on the call. And I know it's late for some people, so thank you for hanging on for this.
No, yeah, thanks to everyone. We barely lost anyone, even though we went going on half an hour extra. Thanks a lot, Lindsay, for the presentation, for all the work that went into the campaign. It's, I mean, it's really important. It's really great material. So I really recommend everyone to go check it out, especially as Peter highlighted. This is now that it's useful. National funding requests are getting funding requests. Creation process is getting started, and national consultations are starting everywhere. So it's really important. Robin, floor is yours.
All right. So looking at the One Forces campaign, what can we as GFANers do to immediately support this in action? So the briefs that we've been sharing are really about achieving 146 by 24 in NFM4. So we know that the Global Fund Replenishment Conference is behind us now. There's a new allocation methodology for the 2023-2025 period, and country coordinating mechanisms are starting to engage key stakeholders in country dialogue processes to develop national funding requests. So together, GFAN, TAG, and TB Alliance with some of its support through my time have developed these briefs to support you to be effective advocates in those spaces. And I'm going to show you those briefs in a second, but I just realized that I didn't introduce myself, so I'll do that as well. So I'm Robin. I've met a number of you previously when I was working with Results Canada, and campaigning vigorously in support of getting $1.2 billion from the Canadian government, which we did. Yay. I'm no longer with Results Canada, though. I'm now working as an independent consultant. One of my contracts is with TB Alliance, working to support them with TB treatment access advocacy, which is what hat I'm wearing here today, right now. And then I also have a contract with the Stop TB delegation supporting with the Deadly Divide 2.0 consultation. So if you haven't completed that survey yet, we still want to hear from you. I'll share a link to that before I go so you can engage in that consultation process as well, which will be really important in the lead up to the HLM on TB in September. Okay, so I'm going to share my screen to show you these briefs and how you might be able to use them in your work. Share screen. You can see my screen. Yeah. Okay, great. All right. So this is the Wicked Awesome GFAN website. I hope you're all familiar with it. On the banner right now is this new Safer TB Regimens advocacy guides for NFM4. So if you just click more info, you will be taken to this page, which gives you a brief overview of what these resources are for and why you might want to use them. And at the bottom here, there are links to what is now 3 guides, but what will become 4 guides soon. So first we have an overarching introductory brief. This brief gives you an overview as to why we might want to be doing this advocacy right now, where throughout the Global Fund funding cycle we can elevate these asks, and general high-level key arguments and messages that you can leverage in your advocacy to support asks for rapid adoption of these shorter treatment regimens. So these are generic across all regimens. And this really is what the Global Fund does. So there's tons of links throughout. Anything that's blue is a hyperlink to more information in the original source if you want to get access to more content to beef out your arguments even further than what's here. Okay, and then we have briefs for every regimen itself. Just going to go back to where that was. So here we've got a guide coming soon on the 1-month regimen for TB prevention. We have here a guide ready for your use for the 4-month regimen for drug-sensitive TB. And we have a guide ready for your use for the 6-month regimen for drug-resistant TB. And these briefs give you the specifics as to how the World Health Organization is recommending these regimens already and how they are being used in countries around the world to date. They also have key arguments and messages specific to the regimens themselves. So for example, here, your key arguments for why we should be making sure that the new all-oral 6-month regimens for treating DIA or TB are included in national funding requests is because it's more effective, safer, shorter, and more affordable to alternative regimens. And here's all your evidence. So you can leverage these arguments. And if you get pushback for some reason, so for example, say somebody says, well, before we move to full programmatic implementation of these new regimens, we would like to run a pilot project in our country first. There's a bit of a response here for how you can tackle that type of questioning that might be coming your way in those spaces. So we're happy to have launched these. There's also in this brief specific stories from people who have been treated with the shorter regimen. So you can get an in-depth understanding of the impact it's had on their lives. And the shorter duration of treatment really does impact the quality of life for people and their experience of TB treatment. It also has a massive impact on the health system. So going from 18 months of treatment down to 6 means way less investment of frontline healthcare workers' time to be supporting those people that are going through treatment. Yep. So that's a bit of an overview of the briefs that we have right now. If you have any questions, let us know. We'll be pumping them out through lots of different comms channels, so you'll probably see them more than once. If you have any feedback for how they can be improved, we would also like to hear from you. And if you want insider information about the regimens and how they're being uptaken in your country right now, reach out to the contact listed at the bottom of each brief. So TB Alliance, which is committed to the discovery, development, and delivery of new TB treatments. We've got lots of information around how the new 6-month regimen is being used in different country contexts. So if you want more insider information as to what's happening on the ground in your communities, reach out and we can have a conversation and equip you with more than what is maybe in that briefing note itself. And that's all from me.
Oh, thanks a lot, Robin. Very, very intense, very good energy. It's early in the morning for you as well, so very impressive. I don't think I can match that. It's too late for me. Do you have
That's just
any?
my norm. That's how I operate.
Do you have any questions for Robin, or a related question for Lindsay from anyone on the call? I think it was just it was almost too clear. It was almost too good. So I'm giving everyone one more second, but we'll run you through everything: how to get to the website, how to use the briefs, when to use the briefs, etc. We will have the last brief in a week, 2 weeks, soon, very soon. I can see fear
Yeah, you're making me instantly sweat over here, but no, we should have it soon. We're just finishing it up.
All right, so I don't see any further questions. Thank you so much, Robin. Thank you so much, Lindsay, for the presentation. And thanks everyone for sticking with us a bit later than usual. We'll be now closing up the call after a couple announcements. And when I say a couple, I mean a lot. So I'm putting a bunch of links in the chat, going very quickly through what we have. So our annual survey is out. It's very, very important that anyone, especially who are taking those calls, take the time to fill it. It takes 5 minutes. The link is in the chat, and it really helps us figure out how useful we've been to you over the past year, and how we can improve, which is probably the most important part. But if you just want to say nice things, we like nice things. We are also ending, it's the end of the term of our current Speakers Bureau. We're immensely grateful for all the hard work of the current GFAN Speakers Bureau. They've been absolutely amazing, and some of them are on the call tonight. So thanks a lot for your hard work. And so we'll be looking for new speakers or returning speakers. And so the call for application is out. Again, I've posted the link in the chat. We welcome all and every application. All the details are on the website. And we look forward to hear from you. And if you want to nominate someone, just get in touch with us and we'll chat to them. So as I mentioned, this is our last GFAN call of the year. We'll come back in January. I do want to point a call that we are co-hosting next week with Harm Reduction International, UNAIDS, HERA, and NAPUD. It's a bit late for me to go through all the acronyms on the implications of a global fund replenishment on harm reduction. So it's going to be on the 5th, and again, I'm reposting the link to register in the chat at the bottom of that last message. And finally, it is World AIDS Day tomorrow. It's chance to mourn and remember, also chance to keep up the fight. So good luck for all your activities tomorrow. We know it's a busy day for many of us. And with this, and thank you all for the very nice messages in the chat. We will see you all next year. And for those of you who have end of the year celebration, enjoy those, enjoy a break. And for those of you who keep working, some of us have to. And good luck with that. Have a good day, good afternoon, good evening, good night, everyone. Thank you so much to your presenters again. Bye.
Thanks, everybody.
You,
Thanks, everyone.
we appreciate
Bye. Thank you.
We appreciate all of you.
Bye-bye, everyone.
Bye.
Good end of year.
Bye.